Hello, my name is Albeir Messiha, a student at the NTPD program. Today I'm going to present my patient case, which he was referred to me for a comprehensive assessment and a plan of treatment for certain health issues. My patient name is Richard Taylor. He is a 56 years old male who is black or African American. He was married for 24 years and his wife passed away last year. He came today exhibiting active signs of severe depression and COPD. He is a current smoker and he works as an IT specialist. His history of COPD: he had COPD exacerbation last year in March, which he was treated for on outpatient basis with just only antibiotics, but he wasn't hospitalized for it. Physical exam and certain assessment was ordered for him to further evaluate his COPD status. Pulmonary function, according to the physical exam from the patient case, it showed normal pulmonary function. Blood eosinophils count was 50. Spirometry and CAT assessment was done to further evaluate his COPD. The CAT assessment score was 21. According to the current GOLD guidelines for assessment and treatment of COPD, I would classify my patient with moderate severity COPD category group B. The patient COPD status is not well controlled at all. My plan of treatment first is to discontinue his inhaled corticosteroid inhaler as it might be associated with the risk of causing pneumonia. Also, it was found by uh, the guidelines and a lot of trials that was done, it might have a reduced beneficial effect in patients who is current or heavy smokers. Second, I would recommend to initiate a combination inhaler of LABA and LAMA. LABA long-acting beta agonist, LAMA long-acting muscarinic agonist. For example, a neurolepta inhaler direction: inhale one puff by mouth every 24 hours. Also, I would recommend to initiate short-acting beta agonist, for example, albuterol inhaler like Ventolin, HFA, or Pro Air for controlling the acute symptoms of COPD if it happens, so the patient can use it on as needed basis. The direction for the albuterol inhaler is to inhale 1 to 2 puffs every 4 to 6 hours by mouth as needed. I recommend also to follow up with the patient within 4 to 6 weeks, and I would educate the patient on proper inhaler techniques. Also, I would suggest and recommend smoking cessation programs and available pharmacological treatments for smoking cessation. My rationale of recommending the combination inhaler of LABA and LAMA, because it's recommended by the current GOLD guidelines to start a combination of LABA and LAMA inhaler if the patient is having severe shortness of breath and the CAT assessment score is over or equal to 20. The second complaint that I did assessment for is depression. The patient has stated that he suffered severe depression since his heart attack 3 years ago, which has been consistent over the past 6 months. The patient uh, stated that he tried citalopram 3 years ago, which was prescribed by his cardiologist, and he stated that it improved the symptoms of depression. However, it caused side effects for him. He mentioned sexual dysfunction and diarrhea. The patient is experiencing five or more symptoms according to the DSM-5 criteria of diagnosis, which include depressed mood, lack of interest of his hobbies, significant weight gain in the past 6 months. The HAM-D assessment was done to the patient and the score was 16, which indicates that the patient has moderate severity depression. The patient at this point is lacking therapy. My plan of treatment or the suggested plan of treatment by the doctor who saw him is to start him back on citalopram 40 milligram once daily. I would recommend to initiate the citalopram 40 milligram as a part of his plan of treatment, and I would augment the pharmacological treatment with bupropion 150 milligram once daily, as it has a double beneficiary effect for our patient. First, it will help him with a smoking cessation. Also, it will help with the citalopram, the SSRI-induced sexual dysfunction. In addition to the pharmacological treatment suggested, I would recommend as well non-pharmacological treatment, which is psychotherapy, which is recommended by the current guideline to treat depression. In addition to that, I would educate the patient on medication side effects, especially with bupropion. It can cause dry mouth and it can cause dizziness and nausea. So if the patient experiences any kind of these side effects, he should report it to his primary care physician. Also, I would educate the patient on the importance to be compliant to his medications for better symptoms control and better quality of life. I would recommend a follow-up appointment after 4 to 8 weeks, and I would educate the patient to monitor the improvement of symptoms. Thank you so much, and I really appreciate your time. Thank you.